Welcome to Something to Talk About from the Bainbridge Island Senior Community Center. This program, which we do Monday and Wednesday and Friday, is sponsored by Fieldstone Communities of Bainbridge Island. Fieldstone offers innovative and compassionate care. They're located on Rolling Bay. They also have respite and day stay programs. To learn more, to take a tour, or just to begin a conversation, call 360-689-4314. I'd also like to start by acknowledging that the Senior Community Center is on the ancestral homelands of the Coast Salish people, specifically our neighbors, the Suquamish tribe. We honor them and we are grateful for the hospitality of the people of the clear salt water. Today, we have Gigi Hendrickson with us to talk about Partners in Health Engage, the Bainbridge Island Youth chapter, and an upcoming event this Saturday on intersectionality in public health. Thank you, Gigi, for making time in your day to join us.
Yeah, of course. Thank you so much for having me. So my name is I'm the team coordinator of the Bainbridge Island Youth Partners in Health Engage chapter. I was going to go through a little slide with all of you on what our group does and an exciting event we have coming up this Saturday. So again, our name is the Bainbridge Island Youth Partners in Health Engage chapter, but many of you may know us as the Global Health Club at the high school. We're a chapter of the grassroots organization Partners in Health Engage, which educates, advocates, and fundraises for the global health organization Partners in Health. Partners in Health is an organization that rebuilds health systems in impoverished places around the world to expand quality healthcare outcomes. Our mission, alongside Partners in Health, is to make health something that is universally accessible to all people. This photo here is us at our fashion show last May. It just makes me happy every time I see it, so I thought I'd put it on the title slide. So let's get into it. Just some things that we've done in the past to give you all a better idea of what we're about. So our first pillar, like I said before, is education. So our main form of education is weekly discussions we have on various topics related to global health. Because global health is such an intersectional field, we talk about all things under the sun that relate to global health. So we'll talk about climate change, we'll talk about mental health, we'll talk about racism, colonialism, capitalism, culture. We'll talk about all of these things. These are just two photos of us having our discussions. We had some more intimate discussions over the summer. This is us discussing the book Capitalist Realism by Mark Fisher, and this is a discussion we had on capitalism during one of our big meetings. And it's just wonderful to get together with a bunch of people who are interested in exploring topics related to public and global health, and this is one of the most important pillars of our work. Next, we have our advocacy work. For advocacy, the main action we do here is meet with members of Congress. We had 5 meetings with members of Congress last year. We met with Representative Derek Kilmer 3 times, and we met with the staffing offices of Senator Murray and Representative Jaya. We'll meet on various legislation that helps further our mission. We met on the NOVID Act, we met on the Dr. Paul Farmer Moyer resolution, and we talked about spring appropriations. And then this is us at a climate protest last year. We also published letters to the editor about advocacy pieces that we're advocating for, and we'll also do call-a-thons or appropriation request forms and things like that. So this is another important pillar of our work. And it's really nice because this is one of those that feel like we're doing real action and we're actually getting involved in the community, which is wonderful. And then finally, we have fundraising. This is what our chapter is known best for. Out of the 70 chapters in the world, our chapter has actually raised the most money. So we take a lot of pride in our fundraising, and that is thanks to the generosity of the Bainbridge Island community. So we are super proud and grateful to our community for helping us get in that place. But yeah, fundraising, this is kind of where we kick butt. Our amazing community liaison, Maddie Brown, she's in charge of all of our fundraising. So these efforts are really due to the partnership between her and I. I would not be able to do any of this without her. One of our biggest fundraising successes was the Female Power Fashion Show we had last year. These 3 photos all show that. It was incredible. I was honestly kind of blacked out for most of the night because there are so many things going on, but I heard it was a lot of fun and there's a lot of good energy going. Other things we do besides the fashion show, we did a panel event to educate last year as well. And as I'm going to say later on, we're doing a panel event on Saturday. We'll do concession stands, we'll put bracelets in stores, and then all of our members will get together and go door to door asking for money on Bainbridge or reaching out to family, friends, colleagues that they know to ask for money. So that is our third pillar, fundraising. And this year, our fundraising focus is the University of Global Health Equity in Rwanda. This is a medical school that is not just teaching medicine, but also global health leadership, which is super exciting. It's enough that this medical school is being built in a rural area of Rwanda, which is already exciting enough, but it's actually teaching medicine in a new way and giving students the tools to create their own systems and projects to help their own communities. So like I said, this is in Rwanda. So already it's bringing unheard voices to discussions about health. It's teaching health in a way that recognizes systems, the legacies of important historical events like colonialism. And it has this really fun approach called the One Health approach, where it thinks about human health as it relates to animal and environmental health. And like I said, it's also teaching global health leadership. So it's teaching these students how to create systems, how to create and design their own programs in their own countries. So there's less dependency on foreign countries to help them. The University of Global Health Equity has already been built, classes have already graduated, and students have already started using what they've learned in school to make real change. And so we're really excited and honored to be fundraising for this school this year. And this is going to be our fundraising focus for the rest of the year. So how people can support us, the biggest way would be coming to our event on Saturday. This event is a fundraiser for the University of Global Health Equity. We are super excited and honored to have the panelists and the host we do. Chastity Malatesta is hosting this event, and our panelists are Dr. Neil Gupta. He's a doctor and researcher for Partners in Health, the organization we work for. We have Dr. Rabia Yunusa. She is a public health professor at the UW who has a lot of experience in global health, specifically treating violence against women and girls and stigma surrounding HIV. And there's Dr. Stephanie Farquhar. She met with our chapter over the summer, and we are so honored to have her with us. She does a lot of focus around housing, environmental justice, and she does a lot of policy work. So we're excited to have these doctors, researchers, and teachers from all different kinds of backgrounds to kind of highlight the fact that public health can look like so many different things. And they're all going to be talking to us about the health injustices we see in the world today, the importance of an intersectional solution, and then also what Bainbridge Island as a community can do about it. Admission is free, but we're going to have times throughout the event where people are encouraged to donate to help us reach our goal of $2,000 for the medical school in Rwanda. So this is going to be exciting. It is 5:30 to 7 p.m. this Saturday at the Bainbridge Island Museum of Art. And again, it's being hosted by our group. We've had so much support from BEMA, the Bainbridge Community Foundation, Laura Van Dyke. It's just been overwhelming how much support we've been getting for this event. And we're super excited. We have 50 people registered, but we still have room for 20 more. So if you have not signed up and would like to attend, I highly encourage it. You can go to our website to find more registration information. And I think the registration information is also on the Senior Center website as well. Finally, just wanted to show a little photo of our team. I just think this photo is so cute. This is our leadership team. Going from left to right, we have Audra Miller. She's our school liaison. So she connects our chapter to the school. She helps with recruitment and retention and just making sure our high school peers kind of know what our mission is, what we're about, and educating on global health as well. Then we have Dash. He is our advocacy lead. So he's in charge of scheduling MOC meetings, of coordinating the writing of LTEs, coordinating call-a-thons, other actions like that. In the middle is Max. He's our education lead. He's in charge of leading all of our discussions. Then Saya, she's our communications lead. If you've ever read one of our newsletters, she writes those. She's on social media. She just communicates with our network. And then Maddie Brown, our community liaison. She's in charge of all the fundraising we do. And then me at the end, my hair is straight because this was after homecoming. I'm the team coordinator. So I just kind of organize everyone's abilities and make stuff happen.
And they're a great communicator as well. I just want to add that the link to the Saturday event has been on our calendar page, but I will put it up on the homepage between now and Saturday, so it's easy to find.
Awesome. Thank you so much. And then finally, if you're not able to come to the event, but would still like to stay connected with us or support us in some way, the first way is joining our mailing list. And so the mailing list would mean that you stay updated for other events we have going on or other actions we're doing. And it also means you get our really cute monthly newsletter made by Saya. You can also look at our website or Instagram just to kind of see more of what we're doing each month. And on our website is also information to donate directly to the medical school in case you'd like to support the school but can't attend the event. And then finally, if you'd like to email us for any reason, our email is right there as well. And that's it for you guys. Thank you so much for having me.
Well, I just would like it if you could talk a little bit in more detail about what intersectionality means for people who have not been familiar with that phrase. I know it applies not only to health, but to a lot of ways of thinking about issues. And so, willing to do that?
Yeah, absolutely. I'll just start with a simple definition of intersectionality. So an intersectional approach is when you look at an issue like public health and you look at all the different factors, the history, or all these different things that could impact a person's ability to access health. Especially in public health, there are often many, many things going on at the same time. So we're thinking of the health of a person, the area they're in probably impacts it, their race, their gender, whether they're in like a war zone or not in a war zone, whether there's a drought going on or there's not a drought going on. So a lot of different things can impact a person's health. I think that's probably one of the most easy examples for understanding intersectionality. And so it's so important if you're a doctor or a researcher, an advocate in public health, for you to look at more than one of these things at the same time, because if you only focus on one thing, you're missing a part of the bigger picture. And that's what the University of Global Health Equity does so well, specifically with that One Health approach. When they talk about health as something that is reliant on humans, animals, and their environments, then they can see an actual fully holistic intersectional approach to health. And I think that's really exciting because I think a lot of us are very disconnected from nature and the animals around us. And so I've personally never heard of a medical school that takes that intersection so seriously. And I think that is so exciting. One of the examples that they talk about a lot in the UGHE is snake bites. I think a lot of us in first world countries don't really think about snake bites, but those a public health concern in some impoverished countries. And that's a really obvious example of how that's human health, but it's very clearly being impacted by animal health, and then environmental health is pulling that all together. So that's a little definition of intersectionality, but our panelists, and especially our host Chastity, can probably explain it a lot better than me. But we'll be hearing from our panelists on Saturday about how they use that intersectionality and all the different kinds of work that they're doing, whether it's addressing HIV stigma, whether it's researching infectious diseases, or whether it's just advocating. I think they'll probably be able to answer better than I can.
Well, that was a pretty good answer. I also remember I read Mountains Beyond Mountains.
Oh, great book. Yeah.
And talking about Partners in Health's origins and Paul Farmer's view of work in Haiti, I think, particularly, and in Cuba, about the idea of health concerns being related to food concerns, being related to housing. And so that intersectionality is kind of built in to the Partners in Health thinking.
Absolutely. And that's why Partners in Health aims to build systems. They don't go into countries to address acute crises. They really try to focus on systems rather than symptoms. And the University of Global Health Equity is training their students to do the same thing. One of my favorite quotes from Mountains Beyond Mountains is having a poor person go to a hospital, but come home when not having enough food to eat is like washing your hands and sticking them back in dirt. You can build the most glorious hospital with some of the best medical technology, but if people go to that hospital and then come home and there's not food to eat, then you're just like, you haven't created something that's really, truly going to sustainably change communities. And so that's why Partners in Health will stay in countries for decades to actually work with local professionals, hire community health workers, build clinics, yes, but also set up water and sanitation systems, also set up food subsidies. And all this is done with local governments. So the change that's done in countries is actually sustainable and real and not completely reliant on the Partners in Health leadership, but it actually is a true partnership. That's why they're called Partners in Health.
I'm wondering about how that sort of relates, or maybe your Bainbridge Youth chapter has talked about this, how that relates to the way that we think about health in this country, which is maybe not such an issue of sanitation availability, but the connectedness of very parts of our lives, and starting to look at health as not what pill you're going to prescribe for me.
Yeah, absolutely. And I think something that's really neglected in the United States is how much your mind impacts your body. Like with mental health, I think a lot of people neglect the fact that like your mind really can change your body. Like I know that we sometimes hold trauma at certain parts of our body. I was talking to the founder of the organization Scarlet Road that helps get people out of the sex industry. And something that she does with her clients is they do yoga together. And if she presses on a certain part of their back, like just tears come, and it's so interesting, the interconnectedness between our mind and our body. I think especially in the US though, I think it's very sad just because of our individualist culture, I think it's very hard for us to like want to think about health as a collective struggle. And I think a lot of us think that public health needs are a thing of the past, but food insecurity is not a thing of the past. Housing insecurity is not a thing of the past. All of those things are truly impacting Americans, especially after the pandemic. And those are all public health crises. Public health is more than just a disease, more than just an infection. Public health is definitely a prevalent need. And I think we need to expand our views of it. And that's intersectionality helps us do that.